Today, let's go through the ins and outs of tibial stress fractures. Your tibia takes about 75% of your body weight. Combine all that stress with all the muscle contractions that are happening in and around the tibia, and you can run into some problems. No wonder tibial stress fractures are the most common stress fracture. There are some important biomechanics to consider when dealing with these injuries. The medial aspect of your tibia has to deal with more compressive forces, while the lateral aspect of your tibia has to deal with more tensile forces. And we manage these different forces differently. There are different flavors of tibial stress fractures, and you can get a stress fracture in any location on that bone. Most tibial stress fractures occur along the medial aspect of the tibia, specifically in the last third. Luckily, our bones are really good at dealing with compression, and these tend to heal really well with just some conservative management. Stress fractures along the lateral aspect of the tibia are much harder to deal with because of their tensile nature. Combine that with the fact that there's not as good a blood supply along this location of the tibia, that leads these types of injuries to often need surgery for a complete return to full function. When runners are at the beginning stages of a tibial stress fracture, they'll normally report a gradual onset of symptoms that are located along the medial aspect of their shin. Normally this begins with longer efforts and faster paces, but gradually becomes worse and worse with all types of running. Eventually, simply walking around can be painful. Tibial stress fractures are often misdiagnosed as shin splints. I have a whole separate video that goes through how to differentially diagnose these two injuries. But a quick review tells us that tibial stress fractures normally have a very small area of pain that gradually gets worse and is often painful with running and other impact activities. X-rays are normally the first test that gets done on these injuries. Only about 10% of tibial stress fractures are going to be seen on an X-ray. The next step is often an MRI, where that stress fracture will be graded from 1 to 4. The specific grade of injury is really important because that gives us a tentative timeline for when you are going to be able to return to running. Higher graded injuries, longer return to running. If you're dealing with a low-risk tibial stress fracture, there's a good chance you're still going to be able to do a lot of different things. If the injury has progressed to the point where it's hard to be able to get through your day without symptoms, you might need crutches or a cam boot. This is very different than the high-risk site along the lateral and anterior aspect of the tibia, where we normally need to refer you to a surgeon to get a better picture. Surgical interventions are often necessary to manage these anterior cortex stress fractures and normally involve some type of an ORIF. Once we've established that you're pain-free with day-to-day activities, that's when we need to start loading this area with exercise. Bone adapts in a site-specific manner. That means that if you want a bone to get stronger, you have to stress it. For the tibia, that means we need to progress you through a lot of single leg activities and specifically calf strengthening activities. Long term, we need to get you doing heavy weights in the gym as well as some plyometric exercises to hopefully help strengthen that fracture site so it's ready to deal with running. And even though you can return relatively quickly to these injuries, the risk of injury does not go away for a long time. A study by Pope and colleagues found that 33% of runners dealing with a tibial stress fracture do not return their normal bone density a year after diagnosis. This is really important because a denser bone is going to be less likely to fracture. This is probably why we see so many runners that re-injure this area in the year following diagnosis. That's why it's so important that the progression into running needs to be very slow and steady, needs to be accompanied by a solid strength and conditioning plan, and often needs to include some advice from a dietitian on how to properly fuel during this time period back to 100%. First, we need to start with running every other day. That day off between allows us some time to recover from the previous day's run and to assess how your symptoms are feeling. It's important that you incorporate 5 to 10 minutes of walking in your warm-up or cool-down during each running session. Initially, all running is done at conversational pace, meaning that it's very low in intensity. And lastly, we want to make sure that you're incorporating a walk-run progression and not simply going out and running farther each day. I like using the walk-run progression because it gives you time to assess how you're feeling throughout the session. It also gives you an easy way to pull the plug if things aren't going well. And that's really important because your return to run progression should be absolutely pain-free. That's not to say that a lot of runners don't exhibit some types of sensation around the fracture site, but you should not have pain as you return back to training. There are some other red flags that you need to consider during your return to run progression. You should never run through altered mechanics. If you start to feel like you have to move differently secondary to pain, you need to cut it short. Running through altered mechanics is never helpful. You need to make sure that you are at 1 out of 10 pain or less. Lastly, you have to trust your gut. If there's something that you're feeling that is concerning to you, pull the plug on the run. This is a standard return to run that I use with a lot of my patients. Now, after you've got through this steady return to run progression, theoretically, the best way to progress training is to focus on frequency of training first, followed by running volume, and finally running intensity. You want to build up some consistency in training at a low intensity that gradually builds your volume, and then determine what amount of intensity do I need in my program. Overall, it's important that we pick one variable at a time and slowly progress through them as you go through the rehab process. These injuries take a long time, a lot longer than you would like. It's important to be steady in the approach, comprehensive in how we're attacking these, and give yourself a little bit of grace when you're frustrated along the way. Thanks for taking the time to watch. I hope you found this video helpful. If you want to learn more about stress fractures, be sure to pick up my guide to navigating stress fractures below in the description.